Hi everyone, Dr. Remy from Pain Free and Fit. Today, a great video for those of you with lower back degenerative, herniated, and bulging discs, L2, L3, L4, L5, and S1, how to train legs, quadriceps specifically, with leg extensions without irritating lower back symptoms. Hope you enjoy. So remember, with degenerative disc disease, herniated discs, bulging discs of the lower back, L2, L3, L4, L5, S1, discs typically are going to become aggravated when we have a flexion or a bending forward from the waist component on them, or when we have a seated compression, because sitting can put up to 12 to 13 times your body weight pressure on the disc. That's why working out in a seated position can sometimes be very dangerous. We always like to protect the disc by engaging our neutral spine and RPI. Again, that's unique and different for every person. My neutral spine position is going to be different than yours. For me, I'm going to work on keeping my left hip down, avoiding raising it sideways, called hip hiking, and avoiding leaning in slightly to the left-hand side. That's my particularly unique movement and posture tendency, a dysfunction that I strengthened over many, many years. We all have our unique dysfunctions or imbalances, so you have to learn what yours are. I'm also going to be engaging my left multifidus at L5 because that is my inherent weak link in my core muscles. If you're not sure what your unique RPI neutral spine is, check out our painfreeandfit.com website. We have a free body analysis to help you get started, to help you learn some of the basics about your posture, alignment, and muscle imbalances. Once you engage your RPI and the seated leg extension, we're going to avoid the typical tendency to flex forward on the spine, which a lot of people do when they do leg extensions, especially to eke out those last few reps. Again, I'm already seated, so I have more pressure on my discs than usual. As I perform a leg extension and the weight starts getting heavier, many people have a tendency to throw their heads forward a little bit to help that weight come up. When our heads translate anteriorly or forward, our low backs start to also follow that movement of the upper spine. Remember, the spine is one long chain of bones. So as my head or my shoulders either round or come forward, there's a tendency to lose that arch in my lower back and have the top of my lower back start to tilt forward. That little bit of incremental change many times is enough to irritate hot disc problems and many times also chronic degenerative disc disease in the low back. So as I come up, what helps many times to take that component out of it is to actually lean slightly back, so that as opposed to typical seated posture where your ear, shoulder, and hip are all in alignment and your weight is on those sit bones or those ischial tuberosities between the back of your thigh and your buttock, we're going to actually lean back past there, but carefully what I'm going to do is I'm going to allow my whole body, my ear, my shoulder, my hip, to lean backwards. So I'm not just leaning back by rocking my pelvis, that would cause a slump, but I'm leaning my entire body backwards. And if I want to, with my hand position holding on, I can actually use my hands as opposed to lean into. I'm keeping the same type of curve or arch in my lower back that I placed at the beginning of exercise, my neutral spine. The rock back occurs from the hip joint, so my entire pelvis is rocking backwards on the top of my thigh bones. And here, as I keep that alignment, you'll notice I can isolate my quads a lot better and take the stress out of my lower back. By posteriorly or backwards moving my center of gravity, it also helps to decrease the compressive sitting vertical forces on the disc. So leaning back like this, you're going to get a lot more tendency to bomb the quads with a great workout and avoid the compressive effects on the lower back, which probably you're doing leg extensions anyway, because you may have noticed that squats and heavy leg presses, vertical compression on the spine is too much for your lower back. So hitting or targeting the quadriceps and the thighs can be achieved a lot better with leg extensions. Keep these tips in mind. It'll go a long way to helping you prevent pain at the L3, L4, L5, and S1 discs in your lower back, whether they're degenerative, herniated, or bulging. If you like this video on leg training, leg extensions for degenerative, herniated, and bulging discs, check out our channel, subscribe to it. We've got a lot of great videos out there to help you. If you're looking to help me help others, give me a thumbs up below. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great program to figure out what your body mechanics are, what your stability issues are of your lower back, what your posture and movement tendencies are, how to correct them, how to create a neutral spine, how to have a good analysis on yourself so you know how your neutral spine is different than anyone else and prevent the stresses from going to your discs, check out our fast track program for degenerative disc disease. It also applies to herniated and bulging discs It's available at the painfreeandfit.com website. It'll teach you your full body analysis, all the techniques you know, how to learn how to re-coordinate your core, and a step-by-step program of how to put together not only rehab, but get back into sports and working out and fitness to prevent lower back pain. I hope this video on leg extensions and degenerative herniated and bulging discs helps you with your chronic lower back symptoms.